In your health headlines, it's the most common form of cancer in the U.S., with 1 in 5 Americans developing it over the course of their lives. We're talking about skin cancer, which is also one of the most preventable types of cancer. So think of it that way. Dr. Mitchell Goldman is here now with the ways to prevent it and what to watch out for. And we were talking during the commercial break. It's so apropos right now. We're having this heat wave. It's so hot. It's so dry. And you say even with the advent of sunblock, skin cancers have tripled.
It really has. Just since I've been a dermatologist for 30 years, now 2 million people are going to get skin cancer in the United States. 120,000 are going to get malignant melanoma, which is a potentially fatal form of skin cancer. And the reason is that even though we're using sunscreens more today, and when we use a sunscreen, it has to be with a sun protection factor, SPF of 30, we've got so much sun growing up, both you and I and most of us, that we're still at risk.
All right, so the damage is somewhat done, so you have to be extra careful. So let's actually talk about what to look out for, first of all, if you're people like you and I who spent a lot of time in the sun in our youth and then wised up. So what are the things?
Well, the most important thing is a changing mole or a changing growth. If something is not healing on your skin, if growths are changing, that's what you should look for. And we use this A, B, C, D, E. So if it's an asymmetrical mole, if it has irregular borders, if it has irregular colors or a change in color, so there's reds and blues and browns and blacks, if the diameter is larger than a pencil eraser, or if it's elevated, if it has those things, go see your board certified dermatologist.
Yeah, and get checked out at least once a year, or have someone at home look at your back. I had a friend who passed away from melanoma because she had a mole on her back that she never saw.
And when you see your dermatologist, make sure wear a bathing suit or clean underwear, because we're going to look at your whole skin surface, because as you just said, melanoma can occur on areas of your body that you don't really look at. I've found them on the legs, on the feet, the bottoms, in between the toes. So your dermatologist is going to look everywhere to find the skin cancer.
Well, let's talk about, aside from the obvious, you have 5 simple ways of protecting yourself. We all know sunblock is a big one, and let's put up on the screen for our viewers what the other ones are.
Well, it's really important to, when you're out in the sun, to be in the shade. And then when you're out in the sun, you know, especially if you're in the water, you're going to get the sunshine coming up from the water, and in the snow, from the snow as well.
Yeah, that's that albedo, that reflection.
Yes, you almost get double sun. The other things are when you're in the sun, because look, we live in San Diego because this is the best city in the whole world, but we just have to be smart. We can't be out between 10 and 2 without sun protection, wearing hats, long sleeve clothing, and sun protection.
All right, very important and timely reminders with this heat wave we're having over the course of the next 3 days, so thank you.
Good to be here.
Dr. G, and he'll be back next Tuesday. Andrew, over to you.